this video, we will be discussing the causes, factors, and influences which impact a population's birth and death rates. From there, we will also be able to understand the reason for the rapid increase in the world's population and why it is now slowing down. Now, as we stated in previous videos, population change is influenced by the birth and death rates. If the birth rate goes up and the death rate goes down, there is an increase in population. However, if it is reversed, population decreases. If both rates go either up or down, there is no population change. Therefore, we need to understand why the birth or death rate would either rise or fall. To do this, we would have to look at four crucial factors: social, economic, environmental, and political or SEEP factors. Social factors refer to human influences like religion, community, cultures, or people's needs. Economic factors refer to financial needs, such as a country's gross domestic product or GDP. Environmental factors refer to wildlife, animals, and the natural ecosystem. Political factors refer to governmental laws, policies, and regulations. Note that these four factors aren't used ubiquitously, so some causes may not use all four factors. For starters, a high birth rate could be caused by a multitude of reasons. In most cases, a high birth rate is normally found in poorer countries, called less economically developed countries, or LEDCs. Socially, this is due to the following. 1. Poor countries often look at children as assets to family survival. Children are used as manual labor in farming, so the more children one has, the more prosperous they are. 2. Poor countries lack proper healthcare facilities and pension provisions, meaning that children are used to take care of the elderly. 3. Poor countries often lack good education systems for sex education and contraception, so women often have children at a very early age. 4. In traditional cultures, children are seen as a power symbol, so more children resemble greater prestige. 5. Some traditional cultures favor polygamous relations, which are marriages of more than two people. This means that men will often have children with several women. 6. In traditional societies, boy children are seen as assets, so a couple will keep having more children until a boy is born. 7. In many religious countries, they oppose the use of contraception to reduce childbirth, leading to more children. Economically, we have the following. 1. Poorer countries do not have the money to hire laborers. Therefore, couples will have children to increase family income. 2. Due to a lack of healthcare and proper medication, couples will have many children to ensure that some of them can survive till adulthood. In addition, poor healthcare also means that children might not survive childbirth, so parents will have many children to mitigate this. In terms of environmental and political factors, there are none which pertain to high birth rates. Similarly, with countries that have low birth rates, we can use the same factors. What we notice, however, is that countries that have low birth rates are normally rich and wealthy, as known as more economically developed countries or MEDCs, and therefore, we will see that the factors that cause them to have low birth rates are contrary to those that cause LEDCs to have high birth rates. Socially, we can then see the following. 1. In developed countries, the availability of contraception and sex education allows for women to make informed decisions on whether they want children and ways to reduce the chances of having children. In most MEDCs, contraception is free. 2. With the rise of women's rights and women involvement in society, known as emancipation, women often would rather focus more on their occupation as opposed to starting a family. Therefore, couples will often have children late. Now, economically, there are the following reasons. 1. Children are often seen as liabilities as they cost couples a lot of money to raise. The USAID estimated it to be about $233,000 United States dollars to raise a child to 18 years of age. Therefore, some parents would rather use that money to live better lives. Now, let's consider the reasons for a high death rate. Death rates, also known as mortality rates, are a little more complex than birth rates as the causes of death change rapidly. The presence of natural disasters, disease, and war can cause death rate to grow, so mortality is often not bound to specific countries. In terms of SEEP factors, we can notice the following social and economic factors. 1. In countries where medication and healthcare is low, people are more prone to die from curable diseases such as cholera, flu, and diarrhea. Moreover, some LEDCs suffer from STDs and AIDS, which are caused by a lack of contraception, polygamous relationships, ignorance, and lack of knowledge of the disease. 2. In countries where alcoholism and drug abuse are prevalent, people, especially teenagers, are more likely to die due to lung cancer and overdose. 3. In countries where war and conflict are high, innocent people can be killed due to attacks. Furthermore, most people can become homeless and malnourished due to war, indirectly causing poverty and death. 4. In countries where healthcare facilities are low, there is high rates of infant mortality, which is the number of children that die before they reach their first birthday per 1,000 live births per year. 5. Life expectancy is also important in considering mortality. Life expectancy is the average number of years a newborn child is expected to live under the current mortality levels. Therefore, if living standards are low, then life expectancy will also be low, and therefore, people will die at lower ages. For example, in South Sudan, newborn children have a life expectancy of 57 years, which is one of the lowest in the world. 6. In countries where there are high fast food diets, obesity causes heart disease and diabetes. High death rates can also be caused environmentally due to natural disasters. These can be earthquakes, floods, tsunamis, and volcanic eruptions. These natural disasters often occur unexpectedly and lead to a rapid rise to mortality. Finally, with low mortality rates, factors are again in opposition to those of high mortality rates. For social and economic factors, we can see the following. 1. Where medication and healthcare is available, the likelihood to cure and regulate diseases is high, leading to a high life expectancy. 2. In countries where there is better knowledge and education of nutrition, people can learn how to have a better diet and exercise. 3. Some countries prioritize in clean water and improved hygiene, leading to better health and a low chance of spreading disease. MEDCs are more likely to maintain a lower mortality rate. However, this is not always the case.